My name is Macie Robinson. I'm going to perform the wound assessment and dressing change. The doctor ordered a wet to moist dressing change for the patient, and the patient vital signs are within a normal range, and the wound will be assessed and the dressing will be changed. And reviewing the doctor order will obviously validate the correct procedure that is being performed on the patient. So I have all of my supplies here. I have my PPE, which is just normal gloves. I have some sterile gloves, face mask. I also have a measuring device. These are sterile gloves. This will be the basin to soak the gauze in. The container that I'll use to draw out solution with a syringe. 2 pieces of gauze. A few Q-tips and a sterile dressing, some antibiotic ointment, a syringe, a solution, a waterproof pad, and the sterile drape. I also have the basin that will be used to catch the solution as I'm irrigating. Okay, so I will put this back. Would knock, introduce myself. Hi, I'm Macie. I'm going to be your nurse today, and I'm going to perform a dressing change. I would also perform hand hygiene, which is located on this wall. Could you verify your name and date of birth for me? And I would look at the wrist for the wristband. Okay, and do you have any allergies, particularly to latex or iodine? Great. Okay, and then I would explain the procedure to the patient and raise the bed. Okay, today I'm going to perform a dressing change. So we're going to take off your old bandage and clean it a little bit with some sterile saline and put on a new bandage for you. And could raise the bed. And go ahead and lift the table up a little bit. And I want all of my supplies to be right next to where I am doing the dressing change, which is on this leg. So I would first put on my gloves. And my face mask in case of any splashing. Okay. And I'm going to pull the blankets down just a tad so I can look at the wound and pull up the gown just a little bit, but still providing privacy. Just pretend that the dressing is on here. I would lay down a waterproof pad underneath the wound. Okay. And could you lift up your bottom while I place this underneath you? And lay down the water basin underneath the wound for the irrigating later. Okay, and I would slowly pull off the bandage, and if the bandage stuck to the wound, I would use some sterile saline and soften it. That way it didn't stick. Okay, so I'm assessing for redness, tenderness, swelling, irritation, and at this point I also measure the wound. I'm going to measure the length, width, and depth. I'm going to get eye level and use centimeters. I'm not going to touch the wound. I'm going to keep it just a few inches away. It looks like it is 9.5 inches wide, or centimeters wide, and 2.5 centimeters deep. Okay, and now I use my Q-tips, and I'm going to assess the depth. Actually, I think I'm going to do that as I'm applying the lubricant. So I would throw this away. Okay, at this point my gloves and my hands are soiled, so I'm going to take off these gloves, perform PPE, and get my supplies ready. Okay, so first I would set up my sterile drape. And the outer two edges are contaminated, so I don't want any of my supplies on the outer two edges. And I would add the syringe, the Q-tips, the lubricant, and cup, the container to hold the gauze, you could open a tad bit of the tape and hang it on the end of the table here, and the bandage. Okay, so now I can add my sterile saline. I'm going to lick it first, and my trash can is right underneath my table. Okay. So now I would perform hand hygiene again, and then go ahead and put on my sterile gloves. And the trash for this. And I'm going to go ahead and get started with the irrigation. So I will pick up my syringe and draw saline. Okay, now I'm going to use my non-dominant hand and place it around the wound. I'm irrigating inside to outside, top to bottom. Okay, and I'm just going to drop my syringe down in the basin. I'm going to leave my hand here since it is contaminated now. I'm going to soak my piece of gauze in the sterile saline and get it nice and saturated. And while that's soaking, I'm going to squeeze a little bit of the antibiotic ointment onto the Q-tip. And apply that very gently. And as I'm doing this, I can measure how deep the wound is at its deepest point. And then I would compare that to the container that held the Q-tips, which I don't have, but that would be examined. And now I'm going to throw this away because it is contaminated. Okay. I'm going to go ahead and get my soaked gauze and place it inside the wound. This will keep it nice and moist. And now I grab my clean bandage. And I apply to the outside of the wound. And at this point, since the wound's covered, I can use my non-dominant hand to hold it as I tape it. Okay, and at this point, I'm going to go ahead and remove my PPE because it is contaminated, although sterility isn't as important right now since the wound is covered. And I'm going to clean up around the patient first to make sure that they're comfortable. And then I would clean up all of my supplies. Okay, and now I'm going to assess the patient and lower the bed, make sure that the table, his bedside table, has his personal belongings on it and it's close to him, along with the trash can and the call light. Okay. And are you feeling any pain? How does that dressing feel? I'm going to go ahead and lower you back down. Can I do anything else for you while I'm here? And at this point, I would document the procedure and the patient's reaction, and perform PPE as I leave.